Hello, hello, hello. I am happy to be here today again, everyone. I am going to speak to you today about important processes in psychotherapy. As you might have noticed, I am not in my office today. Got that beautiful drawing of my kids there in the background. I am working, I'm at home. Today is a public holiday, as those of you who are in Australia are aware of. Right before this live here on Facebook, I just had a live on Instagram. And I was talking about a totally different topic there in another language. So here we are. Today I'm going to speak to you about the process of psychotherapy. This talk is both for people who are seeking psychotherapy or for therapists with different approaches to treatment. I try to go straight into it and we'll try to clarify at any given point whether I'm speaking from a client's perspective or from the therapist perspective. So the first thing I want you to keep in mind is that when we go and seek treatment, when we attend a therapist's office, we are often walking into the office in a state of ambivalence. We're walking into the therapist office because we're having some internal psychological problems. We're having certain issues in our lives that are driving us to go and see someone and seek help for the problems that we're facing. At the same time, as most of us who are familiar with this process, when we approach and when we walk into the therapist office, there are certain issues that we are really uncomfortable to speak about them with our therapist. So we really walk into the room in a state of ambivalence. We know that there are certain internal issues that we should look into them, that we know they are probably associated with our underlying problems. We know they're painful. We know they can be guilt-inducing or anxiety-provoking. So we do not want to face them on one hand, and at the same time, they're causing us enough problems that we had sought to see someone for them. So when we walk into the therapist office, on one hand, we are really hoping that the therapist is going to understand what the core issues are. And at the same time, we might consciously or unconsciously lead the therapist away from our inner underlying issues. And this creates a very interesting setup. And what I'm going to speak to you about to you today is what are the important principles that we can be mindful of as a patient or as a therapist to facilitate this process, to make the process a bit easier for both parties in this interaction. Number one is, as a therapist, first you need to figure out what is the patient's internal psychological problems. This is an important issue because if a patient does not have an internal psychological problem, we are not able to help that patient. And I'll try to demonstrate this with some examples. If someone attends into the therapy room and they complain to us that their husband treats them badly, or they compare, and that's a horrible thing, but we're not treating the husband, we are treating the patient, and we might spend many, many sessions speaking about how bad the husband is treating the patient. However, she or he will not really get better. So, or other examples are that the patient might talk about financial problems or not being able to find a job or other issues that on surface they all seem like problems, but they're not internal psychological problems. So what is very important is at any given moment as a therapist, you need to reflect and see, have I really understood what are the inner psychological difficulties that are driving this patient to come and see me today? Without understanding those issues, without having that clarity, without figuring that out, you're not likely to be able to achieve the treatment goals because you haven't focused on what the underlying internal problems are. There's a tricky thing here, and I want to clarify it before I move to the next topic. And the trick here is that we might have different approaches to psychotherapy, and generally speaking, we can talk about two main approaches to treatment. Some approaches to treatment are what we can call them explorative approaches where you try to work with the patient and understand what the inner issues are and help the patient figure out those problems and overcome their inner conflicts. On the other hand, you can have some form of approaches to treatment where you can call them more supportive type of approaches, where you try to provide patient with counseling, you try to give them solutions to their problems, you might encourage them to change their behavior. And while they're both valuable, I'm more inclined towards explorative type of therapy where you assist the patient to face their underlying issues as opposed to just being a supportive person in their lives. So I thought it's important to make that clarification. So we talked about the ambivalence, where each patient approaches treatment in a state of, on one hand, wanting and needing help, on the other hand, having certain conscious or unconscious defenses that is it works as a barrier against getting to the root cause of the problems. So the first question is, for the therapist, have I understood what are the internal psychological problems that this patient is facing? If you are a potential client and you're seeking to go and seek help, it's probably worthy to think about it and see what are the inner issues that you're having. What are the inner issues that you want to seek help? If you're going there to talk about how bad your boss treats you, or how, again, you're kind of having financial problems or issues like that, you're not really facing what the inner issues inside you are. The second important principle is that the internal problems that we have identified should cause certain difficulties in the patient's life, otherwise they will not be motivated to address the problems. And I'll try to elaborate on this and clarify it a bit. For example, a patient could come in and say, I don't have a good relationship with my children, or I don't have a good relationship with my partner, or I'm not as productive as I could be at my work. Okay, so this is a problem. How is this a problem for you? What kind of problems it's causing in your life? That's a very important thing, because just because the patient says that they're having a problem, it doesn't necessarily mean that it's actually causing difficulty in their lives. For example, a patient could come into my office and say, I ask them, what are the problems that bring you here today? And they say, I'm an alcoholic. Now, being an alcoholic is not necessarily a psychological problem. Some people are happy being alcoholics. So we're kind of going to ask them then how being an alcoholic is a problem in your life. What kind of problems being an alcoholic is creating for you? So that's very important to say. Not only we need to understand what are the internal problems, but we need to know what kind of difficulties are they causing for the person. For example, an alcoholic, a person who's an alcoholic might have problems with their self-confidence, might not be able to do the activities that they enjoy. It might affect their relationship with their family members. These are important issues to explore and see on which of these issues you see certain level of activation in the patient when they speak about it. There is a lot about being able to read patient responses to your treatments, and this is what we call kind of in some ways intervention response process, that as therapists we don't just want to say a word to a patient, we want to do an intervention and see how does that intervention impact the patient who receives it. And that clearly will need developing certain level of skills. I highly recommend any of you, if you're training or you're trying to improve the quality of your work, I highly recommend to video record your work and watch it with expert therapists or with your supervisor, because nothing improves your clinical skills more than being able to observe yourself and get feedback from people who have more expertise or have a different perspective than yourself. So far we've talked about two important principles. First, figuring out what are the internal psychological problems that we're seeking help, and what kind of difficulties are they causing for us or they're causing for the patient. The third one is to make sure that the patient wants to do something about those problems. Because I might have internal psychological problems that they are causing me difficulties, but I don't necessarily want to do anything about it. And I know this is a bit of a strange situation because why would a patient walk into an office with these problems and say that they're causing them difficulties, but at the same time might not want to do something about it? That's a very interesting thing, and it goes like you can look at it case by case. Sometimes the patient is too nervous to look into the issue, so they take the position of not really being motivated. Sometimes they believe that you are the expert and you should be doing it. Sometimes they do not believe that they can do it, so it could be different reasons. But nevertheless, or it really doesn't matter what the reason is, we need to have that inner wish and want in the patient to be able to achieve those goals. Internal psychological problems causing the patient difficulty, wanting to do something about it, believing that they can do something about it. Now that's an important thing because a patient could come in, have all those other factors, problem causing them difficulty, want to do something about it, but they believe nothing can be done about it. I just beat myself in my head. I just beat up on myself. I cannot stop telling myself negative things. So in this case, it's a very important thing because that sense of powerlessness, that sense of hopelessness will all work as a barrier against the possibility of change in the patient's life. So this is another important issue that we need to have that belief that something can be done about these inner psychological problems that I'm facing, and I have chosen to go and see this therapist that I want to see, that I believe these problems are causing me problems, that I want to do something about it. I believe I can do something about it. I believe that I want to do something about it now and with this therapist. So these are the other next two to think about. If a patient has all these problems, but there is no urgency in wanting to treat them, they're like, yeah, this is really bad. Yeah, alcohol is screwing up my life. Yeah, my wife. Yeah, my kids. But you know what? I can still go on. I don't need to do anything about it now. She still hasn't left me. One of the classic ones is waiting to hit the rock bottom and then do something about it. Or it's not that bad, or rationalizing it, or minimizing it. So it's important to recognize that it's that sense of urgency there, that the patient wants to do something about the problem now. And the last one, as I said, they want to do it with you. What does that mean is that the patient is not sick, for example, saying, yeah, these are real serious problems, they're causing me difficulties, something can be done about it, and I believe that, but they do not necessarily believe in wanting to share those problems in that context, in that therapeutic setting with you. So these 5 or 6 factors, depending on how you're looking at it, are really 6 very significant issues that as a patient or as a therapist we need to be mindful of, because they somehow clarify all the main defenses that patients unconsciously or consciously use to avoid facing painful or anxiety-provoking issues. Now that I have your attention, I wanted to thank every single one of you who has attended this live today. As you have noticed, these are really early days on this page, but I've got big plans here. Feel free to send me any questions about the therapeutic process or personal stuff if you feel comfortable. Clearly, I'm not going to do therapy here, but I'm more than happy to provide you with psychological education. I want to thank all of you for tuning in today. I hope you're having a lovely long weekend, and I will see you next time. Take care.